Sleeping position is extremely important because if you're not sleeping well or you have a lot of pain waking up, it could be either the bed it's either too soft or too firm, or it could be the positioning. There's a lot of patients that have, for example, wake up with a real bad frozen shoulder because they sleep right onto the shoulder. I'll show you in terms of the positioning, for example, of what to do and what not to do, especially in terms of side lying. I normally advise patients to sleep on the left side because it's generally better for your circulation. So rather than sleeping on your back or right, the left is generally preferred. Now, in terms of the shoulder, it's important if you lie on your side to make sure that your pillow is at a good height. So it's not too high or not too low and too soft. We'll make sure that it's a firm pillow, and the height should be preferably, depends on the width of the shoulder. But in Krisha's case, this is actually good height for her. See how if she's leaning right onto the shoulder joint. So if she's in this position for a long period of time, it will tend to jam up that joint. So what I'll suggest is bring the shoulder down. So you're sleeping more on the shoulder blade like that. And then you can have the hand through here. So she's leaning and having pressure onto the shoulder blade rather than on the shoulder joint. In that way, most likely when you wake up, you're not going to have shoulder stiffness. In terms of the head position, it should be pretty much a little bit into neutral. So just into here. So she's pretty much looking straight ahead. So she's not avoid flexing forwards like that, or avoid curling over like this. So try to always just keep yourself relaxed. So avoid doing this type of position. In that way, you most likely will wake up with a lot of stiffness in the neck because you're hunched over for a long period of time. So the neck should be neutral, so pretty much in like that. Always tuck the pillow close to the shoulder. So avoid the pillow being like this. So there's a big gap here. If that happens, a lot of times as you sink into the pillow, it will cause your neck to tilt to the side. So always try to make sure the pillow is right underneath the shoulder. With the leg position, what's important is to make sure that you try to avoid crossing this leg over. So you want to avoid this. So you can see when you do this, there's a lot of twisting and rotation happening on the pelvis and also the lumbar spine. Ideally, you want to try to have the bottom leg. So if, let's say, for example, you're sleeping on your left side, you want to have the left leg bent more than the right leg. So try to bend this more. So bend through here. And then this leg can be behind. So this leg can bend more. That's it. So like this is ideal. So anything like this, where the bottom leg is bent more than the top leg. You can always use a pillow for support, especially if you find you're getting some knee discomfort or you're getting low back pain. You can always use a pillow to support the weight of the leg.